David Mason, the Director of Public Health for the town of Sandwich, and we're with Chief Burke for a PSA number 15 in the second wave. We have a lot of new news to discuss. Some of you may be aware of it by the airing of this, but we'll just give some explanation of it also. But as we usually do, we'll start with an update from Chief Burke.
All right, thank you, Dave. Looking at the numbers, only 28 active cases now in town. We've had at least plus 700 recoveries. The death rate is up. We haven't talked about this, but we did have, I think we're up around 17 now. I mean, we were hovering at 3 for a long time. A good percentage of that is nursing home and assisted living, but those numbers did accelerate here over the last month. Statewide, yesterday was one of the lowest days in about 3.5 months. It was under 1,975 cases. Last time we saw that was in October. So we are definitely trending in the right direction. Hospitalizations are down again in the high 20s with single digits in the ICU. And that's down from a high of, it was in the 60s, I believe. So we're coming down and we are trending in the right direction.
All right, so again, we'll jump, there's a couple things we'll discuss, but let's jump to vaccination because that is the primary issue that's on everybody's radar. Just as an update, as of today, we received a letter from Secretary Mary Lou Sutters from the Executive Office of Health and Human Services that local municipalities as of March 1st will no longer be providing vaccine. But there is a couple things within that and that we'll discuss. One, just to, so you understand, if you have received your first dose from the town through the clinics that we have offered in town, if you've received the first dose, the state has committed to providing us the second dose. So you will be provided that second dose. And we will reach out to you as far as timing and scheduling for that. The other component of what the state's looking to do is address the homebound population, and Chief Burke is going to speak to where we stand with that at this point.
Okay, thanks, Dave. So some of you may have seen our mobile testing truck that's been around town. We retrofitted that back in June. The goal was to look at not only mobile testing, but then mobile vaccinations. So last week we did a pilot program. We went to 6 homes in town, the town nurse and our mobile unit. We did homebound vaccinations, people that qualified. What we're looking at from the state now is, and they're gathering numbers, we're hopeful there'll be a commitment to supply the town with enough vaccine to handle the homebound population. That population's already been determined via Council on Aging and other metrics that they have, including Meals on Wheels. So the hope is that we can at least get those vaccine for the homebound, and then you'll see our mobile unit. We have a dedicated paramedic that all he does during the day is COVID, testing, vaccinations. He'll be out there with Joanne, being able to do the homebound vaccinations. And those numbers vary. I know they're, just north of about 200, give or take. And if we can average 20 to 30 homebound vaccinations a day, within a 10-day period, we should be done with everybody that is considered homebound in town if we receive the vaccine. And that's the hope. The delegation, the legislative delegation on the Cape's working very hard to make that happen. And we would see that as a win. At least we could handle our most vulnerable population in their homes. They would not have to travel. Okay,
so just to be clear on that too, as far as one, as Chief mentioned, we did receive those numbers. We know who you are individually. We're just looking at the total number. We do not need a call. You don't need to reach out to anyone. Sit tight. We have not received the vaccine yet, but we will be addressing homebound. We have a definition for that, and based on the Council on Aging and the matrix, as far as who we're aware of that are out there, we will be addressing that population at this point. You'll be receiving additional information as time proceeds with regards to vaccination sites. We still have Council on Aging reaching out and supplying information for vaccination sites and time slots. There is assistance being offered there for the online registration if you need assistance with that. As of today also, the governor has opened up the vaccination group to 65 and older. So keep in mind, I just said municipalities are not getting any more vaccine. So you need to look online, one, talk to your healthcare provider, two, identify those sources providing vaccines, whether it be the county sites or the state sites such as Gillette.
Correct.
And we'll speak to that in a moment also. But as far as calling for an appointment, if you're 65 and older, we are not taking any appointments for 65 and older because we will not be provided the vaccine for you from the state. So as far as I know that Chief Burke has some experience with regards to Gillette and is familiar with some people. Do you want to speak to that, Chief?
Yeah, so the Gillette site, again, convenience-wise, 45 minutes, not optimal. Still a push for a site here on the Cape for mass vaccination, but my father-in-law went 2 days ago. We signed him up. He's 78. He went up with his wife. He said it couldn't have been smoother. The process, he had never been to Gillette before, and I think there was a little trepidation there when you've never been to a location. But he said it was very, very well marked. Parking was easy. There was a handicap accessible entrance, handicap accessible parking. He said 20 minutes in and out. And he said the longest was the drive up and back, but it was a pretty straight shot. And his hesitation initially, he was hoping to be part of the people vaccinated here in town. He said he would recommend it to anybody. It was that smooth. He said there were tons of vaccination stations set up. There was very little wait. So on a positive note, I think those that can, I think, pursue the Gillette option. 45 minutes, again, is not optimal. But from what I've been told and what I've seen up there and what I've heard from people, very smoothly run, very well controlled. And again, there's a lot of space up there, and they're used to moving people through. They're used to moving 50, 60,000 people through for NFL games. So they're well versed in it. So I highly recommend, and I know the navigating on the website is not easy. That's the one thing that I did find out when we were helping him sign up. But if the town is providing assistance with signing up, and if you have family members, and the other good part of that is if you are a caretaker for somebody 75 and older, you can get your vaccine also. So if your parents, you bring them, you're 48 years old, you'd be qualified to get a vaccine as part of their caretaker. So, that's the direction where this is going. I know we've voiced frustration in the past. We wanted to take care of our own citizens. I think we're able to handle the 85 plus crowd in town here. I think we're pretty much done handling that, but moving forward, everything, supplies, funding, everything's transitioning to the state-run sites. I will mention briefly CVS and Walgreens do have appointments also for vaccine, so look on their websites, but the options now are going to be those federal pharmacy sites, CVS, Walgreens, Gillette, and then anything that the county can set up.
So I know that the Council on Aging and the town on their website and social media pages has pushed out information with regards to those locations where you can sign up. It is online registration. There are no phone calls. So at this point, if we're figuring in what the governor's thinking is that your 65 and older crowd is more tech savvy, so they'll have a greater ability to do that. As far as you reach out to the Council on Aging, we're holding that for your older age group, so to give them the opportunity to register and the assistance, to provide the assistance for them to register. But if you're looking for the sites, if you go on mass.gov, vaccination locations, you will be able to identify and just go online in order to register for a location at this point. As Chief had mentioned, that as far as the proximity to Gillette, just keep in mind that I believe the governor, in their letter noted that 95% of the population lives within 45-minute drive of a mass vaccination site. So that meets the criteria that Chief spoke to. Again, not an ideal drive, not difficult, but this is what's necessary at this point. We will say that the Cape delegation is fully aware of the needs of this county, and they're working on that. I know they'd like to see a state-run vaccination site on the Cape. If that comes in the future, that will be brought to your attention. But meanwhile, take advantage of what's available at this point.
Dave, I was going to mention two other quick things. When you look at the registration online for Gillette, one of the things they require is a picture of your insurance card, front and back. So if you're sitting at home and before you even get on the website, if you can have a digital copy of your insurance card, front and back, that was one thing that I found when I was navigating it, that the majority of the stuff is easy. It's punch and play. But the thing that threw me off was they wanted a picture of your insurance card front and back. So those of you at home that are looking to go to Gillette, make sure that you have that as part of it. Before you even go on the website, have that information, I think, readily available.
Well, let's talk about that then. How do we do that? Because, we have their attention. If we're signing up at this point, what's if they need a picture and you say digitize, what's the best way to do that?
You can take it with a smartphone. So either if you have one or a friend or a family member will take a picture, they'll save it, and they can send it or email it to your email address, and then you can have it saved on the computer that you're going to be signing up with, whether it's a laptop or a desktop. But that's an important piece of the registration process that I haven't seen heavily advertised. So people get into the website, they get started, they start registering, and then 3/4 of the way through, they find, I need a photo of my insurance card, and it has to be uploaded. So we're telling people now to be prepared ahead of time, get that information photographed, saved on your computer, so when you go to register, you can quickly upload those photos. I think that was something that I did notice, that I think that's important.
Nope, that's a great tip, to be prepared as far as filling out, so you're not wasting time and then having to start over. So that's fabulous.
And then, forget the other point, I'm getting old here. With the transition to 65 and older, so that's 1 million more people that are in the pool to get vaccines. So my big concern, I think our concern, was anybody 75 and older that still has not signed up is waiting for a local clinic. Now we're telling you, moving forward, you want to access the Gillette site or one of these other sites that we mentioned. We do not want to see you get left behind, because again, once it's open, tech-savvy people are going to navigate this pretty quickly. So we'll still have the ability for the support through the hotline to be able to navigate that. I just don't want to see anybody left behind. That was my big concern when they opened it up to 65 and older comorbidities.
Yep.
That some 75 and olders would still be trying to find a vaccine and be left behind. So I implore those people to, if you want a vaccine, you want to sign up. These are the tips. And again, I'll emphasize the insurance card photograph front and back is one of the requirements of registering with the states.
Here's a suggestion too. So if we have, where those 65-year-old plus can help out, if you have a neighbor, a friend, family member, give them some assistance on doing that. Chief just gave you a great tip on how to be prepared, in entering the form. But if you can help them out and get them signed up, that's a huge help to the entire community. And we're always getting calls from people saying, how can I volunteer? Can I do something? Reach out to someone and offer your assistance if you're tech savvy, in order to provide them with the ability to sign up.
Yeah, and I think that's important, the neighbor helping neighbor piece in navigating that technology.
So let's, we'll move on from vaccinations at this point, and let's just have a quick conversation about COVID variants. The state has identified, I'm sure people have heard on the news, the South African variant, the UK variant, the Brazilian variant, and what that really means. So I think as far as in the state, they have identified variant cases. It just means keep wearing your mask. I think you're going to hear a lot of people. There's been a lot of news about double masking now. And I think it's more so of just that control, tight fitting. And that's something you deal with your guys with all the time also, Chief. Can you speak to that as far as?
So any assisted living healthcare facility, our members go in with N95 masks, which are basically the gold standard when we talk about pre-hospital intervention for COVID with mask wearing. Around the station, they're still wearing their regular surgical masks. And again, it's all about the fit. And the interesting part is in the cold weather, you go outside, if you can see your breath coming out of the mask, it's not as snug as you would like it to be. So we remind people, we remind our members of that. And again, we have not had a, knock on wood, in the fire department, we're almost coming up on a year. All positive cases have been outside exposure. And we have dealt with, and I think I mentioned this to you a couple weeks ago, there was a period of time in mid-January where every 911 call we had was a COVID patient. So these guys and men and women were transporting 6, 7, 8 COVID positive patients a shift, and they did not, and they hadn't had their vaccine yet, but due to the measures of mask wearing, hygiene, everything that we've been preaching from the beginning, we were able to avert, you know, a significant disaster with multiple people being positive. So that just reinforces the behavior of the mask wearing.
Yep, so the masking works, and now they're just asking, you know, make sure they're a little tighter fitting. Your cotton ones tend to be a little more tighter fitting. Your you know, softer fabric tends to be a little more tighter fitting. And at the same time, I'll emphasize that, you know, we've had the town employees in office working since June?
May 26th.
May 26th. So, and we have not had any cases, inter-office cases occur. Anything that has occurred has been from outside. It's mostly been direct contact situations. So the point of bringing that up also is we're in an office, we're indoors, we're working with other people, we are spaced out, but at the same time, you know, we haven't had transmissive cases occur in the work situation. And so that translates to the fact that if you're out and you're wearing a better mask and snugger fit, that if you're out shopping or out and about, you know, keep your distance and you'll be okay. You know, again, we've said from the beginning, protect your space. This is just one more step to protecting your space at this point. Do we have anything else we want to go over?
Just thinking in terms of testing, we're up to speed. We've done a couple rounds with municipal employees. Vaccine-wise, for public safety, we're all done. We were able to get both shots. So we had about a 90% compliance rate on the vaccine. Those that chose not to, majority were already COVID positive at one point, and they were going to wait a little bit before they got their vaccine. So I think we're in good shape there. The numbers continue to decline. I think that's important to emphasize. The weather's hopefully going to be getting better. We can get outside more. But I don't think the summer this year is going to be much different than it was last year. I think it'll be a little bit different. There'll be a little bit more freedoms, but I think I'm telling my people in my strategic planning moving forward, I'm planning till December 31st, 2021. For testing, PPE, and COVID protocols. And that kind of falls in line with what the president said last night in his Wisconsin town hall, that he was thinking normalcy or some semblance of normalcy around December. So just to prepare people, we're not saying it's going to be, you know, we're going to be all in on COVID for the next 8 months. It's just for planning purposes, and we've been pretty good about forecasting ahead. We're planning for at least December of 2021 before we can look at making some alterations, at least fire department-wise and public safety, on how we respond.
Very true. I mean, we've had the governor reduce or relax some of the controls set in place relative to occupancy based on the lowering numbers, and we'll see adjustments to that, maybe up and down as we go. But you know, we're going to ride this out until the end of the year at this point.
Unfortunately, yep.
And we'll be fine. So I think we'll wrap it up with that.
I think that's good.
Very good. So thanks again. As always, be safe, be courteous, and help out your neighbor if you can. It'd be appreciated. Have a good day.
Thank you.